Hi, welcome to postpartum class. I am Shar and this is Miranda. We will be teaching the class tonight. If you have any questions or anything, please write them down and talk to your doctor at your next visit. All right, we're going to get started. All right, perineal care. This is the care of your bottom and vaginal area after giving birth. So you're going to be swollen. It's going to be painful. You might have had some stitches, some repair work done if you had any tears. So ice packs are going to be great. They give you disposable ice packs in the hospital. You can also get some for at home. Another thing you can do is soak a maxi pad in some water and put that in your freezer. That also makes a great ice pack. A sitz bath is just a bath of kind of that lukewarm water that goes about up to, to your belly button, if not a little shallower. And you can just soak in that water. That is really comforting. A peri bottle, that's what's in the picture. You can fill that up with room temperature water, and as you're going to the bathroom, you can squirt that. It dilutes the urine so it's not so acidic and burns on those stitches, those fissures, the bruising, things like that. It just makes it easier to go to the bathroom. Please be sure to wipe front to back. We want to make sure you're not introducing any bacteria from your rectum into your vaginal opening where those stitches might be, so that's really important. Also, change your pad every time you urinate. We want to keep that area as clean as possible. Other things that will help are witch hazel and Tux pads. You can buy name brand, generic, whatever you want. You can also soak pads in witch hazel and freeze them as those ice packs. That will also be really comforting for you.
So what to expect with your postpartum bleeding. At first, it will be a very heavy flow. So what we have pictured on this slide are the disposable undergarments that will be provided for you at the hospital. Also, the maxi pad that is pictured there, it's really hard to truly tell the size based on that picture, but if I were to put like two pieces of paper together like this, that is about the actual size of the maxi pads that they will provide for you in the hospital. And then they'll also provide those disposable like maxi pad ice packs that you just kind of crack and then shake it up to distribute the chemical inside that makes it cooling. So what you will do, and like Shar mentioned, that you'll change every time you go to the bathroom, you'll put together this get up, the disposable underwear, the giant maxi pad, the ice pack, or maybe some witch hazel pads in there, and you'll change that whole thing every time you go to the bathroom. This would probably be your routine for the first day. About the second, maybe the third day, you'll go to just kind of like an overnight maxi pad. These are all provided for you in the hospital, but you'll still want to have some of those like super absorbent, maybe overnight pads ready for you when you get home. So this is something we suggest go shopping now, get that ready for you when you get home so you don't have to send your support person out to try to describe what you're looking for. Just take care of that now with your pre-baby shopping. Your provider will recommend for you pelvic rest for 6 weeks, and what that means is nothing inserted into the vaginal canal. So no tampon use, no intercourse for 6 weeks, and we'll talk a little bit more about when to resume or when you will possibly be able to resume that. When you go home, just be watching for clotting or releasing clots. And if you're soaking a pad in an hour's time, you'll want to be call into your provider and possibly be seen just to kind of find out what's going on with that and take care of you to make sure there is no infection started.
So medications, ibuprofen and acetaminophen, which is Tylenol, those are great pain relievers for basic childbirth discomfort that you might be having. If you've had a C-section or had some major trauma during delivery, your doctor might prescribe Percocet or Vicodin, which are prescription narcotics that you can take. Just be aware that especially the prescription narcotics can cause some constipation, and you're probably going to be a little constipated anyway after delivery. So we recommend taking some sort of a stool softener, not a laxative, but a softener. That's really important. The laxatives are really hard on your body and kind of just make things more liquidy to go, but we don't want it to be like that. We just want it to be softer and easier on you when you finally do have to go to the bathroom. And then go ahead and finish out those prenatal vitamins that you were taking. They are safe to take while you're breastfeeding and kind of help keep those nutrients built up in your system for, those weeks after baby's born.
When you are ready to go home from the hospital, the nurses will need to see that you have a car seat for baby. They are not going to check to make sure your car seat is installed correctly, but you do need to have a car seat to show that you're going to be safely taking baby home. You will also be given the option to order a to-go lunch. You're usually going to be discharged sometime in the morning from the hospital, and the last thing that we want you to have to do is go home and think, wow, what are we going to do for lunch now? So they will send you home with a packed lunch for both you and your support person, and you'll get a little menu in your going home packet. You can also schedule a public health nurse home visit. This would be where a nurse would come to your home, weigh baby, look baby over, answer any questions that you have. And you can also set up any meetings with the lactation department if you have any concerns with breastfeeding.
Weight loss. Everybody is going to be different on their weight loss journey after having a baby. You usually lose about 10 to 15 pounds right after delivery. That's including the weight of the baby, all the amniotic fluid, your uterus shrinking back down, all of those sorts of things. So then it's just a matter of losing the rest of the weight. Some of you might never really lose it. Some of you, you'll notice that the weight kind of shifts to different parts of your body, and that's completely normal also. So we recommend starting out with some gentle exercises. Go easy on yourself. You are recovering from a major medical event, so we just want to make sure you're safe about it. If you are an athlete of some sort, a marathon runner, you are a cyclist, things like that, talk to your doctor to see if you can start back on some sort of exercise routine before the 6-week mark. Otherwise, most doctors recommend waiting till after that 6-week checkup before resuming your major exercise routine.
If for any reason you decide not to breastfeed your baby, or maybe for whatever medical reason you're not able to continue breastfeeding your baby, here are some tips for suppressing your milk supply. So you'll want to wear a supportive bra for 3 to 4 days. And by a supportive bra, like a constrictive, like sports bra type of bra to kind of just compress your breast. You may have some discomfort when your milk comes in and your breasts are tender and swollen. So a cold compress about every 15 minutes will help to not only suppress your milk supply, but also just give you some comfort. And for whatever reason, nature has given us cabbage for a soothing thing for breast comfort. So a clean, raw, cold cabbage, just take the leaf of it and just put it right in your bra. It's the right shape and it is soothing when your breasts are swollen and uncomfortable.
Other changes to your body. You went through a major hormonal shift when you got pregnant, and now you're going to go through another hormonal shift after baby's born. So all that hair that you got, that luscious thick hair while you were pregnant, you're going to start going back to your pre-pregnancy hair. So you might notice some hair falling out in the shower. Some of you might lose a little, some of you might lose a lot. It'll just go back to kind of how it was before you were pregnant. So don't be too concerned about it. Skin changes, you could develop some acne, your acne could go away, dry skin, oily skin, it's different for everybody, but just know that skin changes are very common. Your gums may bleed. It has to do with your body getting back to its pre-pregnancy blood supply. So your blood supply kind of increases while you're pregnant, and then afterwards it's starting to decrease again, but your gums get extra sensitive, so you might notice some bleeding while you brush your teeth. Incontinence. your pelvic floor muscles have shifted after pushing out baby. So you might notice that you pee a little every time you cough or laugh or sneeze. We do have a couple of physical therapists in our practice that are really great on giving recommendations on pelvic floor exercises and routines. So go ahead and connect with them to get an appointment set up, and they can kind of get you on the right path for that. And night sweats. Again, it's that hormone shift. So you might wake up in the middle of the night and your pajamas are all wet or the sheets are wet. Go ahead and just kind of have some change of clothes by, and maybe an extra blanket or something to lay on in the night. This should all start to get back to normal about 3 months after baby is born. You'll kind of notice everything evening out again.
I always like to kind of point this slide out to our support people to be watching mom's emotions after baby has been born. It's very common for moms to get something called the baby blues after baby is born. And this is just, you know, those like early pregnancy emotions, again, crying over just the littlest things, or just random, you know, just bursts of, you know, just exhaustion and fatigue, and it all contributes to these baby blues. But when it gets a little bit past that, it may be on turning into postpartum depression. This is where mom isn't wanting to care for herself anymore, not wanting to care for baby. So sometimes it may even take support person to call and make an appointment and just say, you know, the mom, my baby is not wanting to care for herself, not wanting to care for baby. Something is different. Things to watch for would be excessive worry, anxiety, irritability, crying or sadness that does not go away, not being able to sleep even when she is just exhausted, not being able to concentrate, loss of interest in regular activities that she may have liked before. These books that we gave you, page 55, it has a list of all of these things. So just kind of keep this kind of in the back of your mind as something to be watching for if you just feel like something is off and you may need to be seen by your provider.
Adjusting to parenting is a huge adjustment for both mom and partner, father, dad, whoever you happen to be with in this journey of becoming a parent. Your roles will change, especially for moms, because at the beginning, especially if you're breastfeeding or your baby is, you know, a little more colicky than normal, things like that, she's going to be exhausted feeding baby, things like that. So partners, you might have to pick up some of those jobs that mom would normally do. So we want to make sure she's being taken care of and getting enough rest to help her recover after giving birth. Having that open line of communication, talk about things, write things down, figure out schedules, whatever helps you to communicate with each other will be extremely beneficial to your relationship. Have confidence in your parenting. It's very nerve-wracking to become a parent and you're pretty unsure about yourself and about what to do with this baby that they let you take home from the hospital. But have confidence in what you're doing and that you're making good decisions for your baby. And know that all these phases are temporary. I would love to say that each phase will end and never come back again, but sometimes they sort of cycle back through. But just know that take one thing at a time, get through it, and then just kind of move on to the next thing, and you will be successful as a parent.
As mentioned on a previous slide with that pelvic rest, that you should be not having intercourse in that 6 weeks after birth. So when you go to your 6-week checkup, if everything checks out and your doctor gives you the go-ahead to resume sexual relationships, just know that both partners will also need to be both physically and emotionally ready. So 6 weeks is not going to be just a magic day on the calendar that you can just mark and say that's the day, because there is a lot to go on. Like we mentioned in the previous slide, communicate with each other. Mom's body image has really changed. Her emotions and hormones are still fluctuating. You're both going to be exhausted with breastfeeding and taking care of a baby around the clock. So make sure that you're communicating about this, your feelings, and just keeping a sense of humor about resuming sexual relationships. Things will not be the same as they were prior to baby. At that 6-week checkup, your provider will also be asking you your plan for birth control. So just kind of have that in the back of your mind that you'll be needing to kind of think about the plan going forward. Also keep in mind that you will ovulate before your cycle resumes. So even though you haven't gotten your period back again, you still are able to release an egg. So it is possible to get pregnant even though your period hasn't returned. So keep that in mind. And breastfeeding is not birth control. So your doctor will want to know your plan. Be ready for that.
So letting others help. Accepting help for some of you is going to be really, really difficult, but try your best to pawn off some of those duties onto other people. Unfortunately, if the dishes don't get done, they are still going to be there the next day. There are no dishes fairies to be found that I know of. So you're going to have some disorganization at first. Your main focus is going to be that baby and just trying to get through every day and get sleep and rest as much as possible. So expect that disorganization, and then accept that your lives are going to change and that your routine is going to change, and that, just a simple outing to the grocery store is now going to become more complicated because you have to make sure the baby is fed and changed and that the diaper bag is packed and that you have the baby, in the car seat and in the car, things like that. So just know that your lives are going to change and you'll get into a routine sooner rather than later. It'll be surprising to you, I think, how fast that happens. And then community resources, trying to get involved in our area. We have ECFE is Early Childhood Family Education. They offer classes for parents and their children, starting with newborn all the way through preschool. MOPS is Mothers of Preschoolers. It's a non-denominational organization. They meet at Hosanna Lutheran Church, and moms get together and have a speaker, a snack, a craft, get to know each other a little bit. Again, it's networking. The kids, if they're old enough, they go into their own classrooms and do the same thing, snack and craft and activities, and get to make some friends. The Late J League is a great option if you are breastfeeding. They have a great Facebook page here in Mankato. Go ahead and join that group, and the leader is awesome. She will answer questions. You can private message her. She will get you resources and hooked up with anything that you might need related to breastfeeding. Options for Women is a group here in Mankato that you can join and take classes, earn points to buy things from their store. They offer all sorts of other resources to get you financial help, medical help, like as far as insurance and coverage and things like that, and getting you resources through our Department of Human Services and things like that. Parent Aware and Facebook are great options to connect to try to find childcare for your new baby. Parent Aware, you can go online, they have a phone number, or you can do it online. You can fill out kind of a survey of where you live, what you're looking for, and they'll send you a list of providers in our area that you can call to see if they have childcare openings. We also have a couple of Facebook groups here in Mankato, Mankato Area Childcare, and I think Mankato Area Childcare Co-op are two Facebook options. Providers and parents alike post that they either have openings, they're looking for care. It's great to start now and just kind of see what's out there and decide what will suit you best. And then the last one is WIC, and WIC stands for Women, Infants, and Children. It is a income-based program to provide food support to breastfeeding and non-breastfeeding moms and their babies. So that's a good resource to have if you think you would meet their financial guidelines. That is it for our postpartum class. Again, if you have any questions, please connect with your provider and they will help you find the answers to those questions.